In cancer patients, diagnostic testing is the whole axis of which diagnosis is made. So a lot of times it tells you where the primary tumor is, it tells you how far the cancer is spread, to what extent it is spread, whether it's made it into the lymph nodes, and it tells you the places that it hasn't gone. It tells you the places that are free of disease. And all of these have to be taken into consideration when you determine what method and means you're going to do to treat the cancer. Before any type of decision can be made as far as treatment, you have to do staging. There's two mainstays that we utilize for pancreatic cancer. The first thing that has to be determined in pancreatic cancer is resectability. Can we take the tumor out? And the number one thing that depends upon is whether or not the vessels, the arteries and the veins in the area of the tumor are involved. So we require a CT angiogram, which is a computer tomography image of the abdomen with injection of contrast that shows you the vessels, and it tells you whether or not the vessels are involved. We order this before we even send the patient to the surgeon because we know the surgeon can't make a decision without this study. The second thing that we do is we know that pancreatic cancer oftentimes metastasizes to the liver, and that determines on whether or not we want to resect or what treatment options there are. So that we do MRI of the liver here on all pancreatic cancers because many studies have been performed which show that MRI is much more sensitive for determination of metastatic disease than CT is. So we want to know with MRI, is it truly clean? Is there no metastatic lesions at all in the liver before we proceed with surgery?